Hello everybody, and welcome to the first session of the Holistic Health series that we're running. This event is hosted by the University Health Network's Red Blood Cell Disorders Clinic. And today is the first session of a 5-part series for people with red blood cell disorders, also families, friends, and caregivers. So people impacted by sickle cell disease, thalassemia, and other red blood cell disorders. The focus is going to be on presenting and supporting mental health and well-being from a holistic lens. My name is James, and I'm the transition navigator at both Sick Kids and Toronto General Hospital, and I'll be one of the co-hosts for today's sessions.
Hi, my name is Sindhu, and I'm a social worker at the Toronto General Red Blood Cell Disorders Clinic. So we'd like to open the series with a land acknowledgement. And so we do land acknowledgement to recognize the lands that we are on, as well as to identify and confront colonization and white supremacy on Turtle Island. So we are in a virtual space today, and so I encourage you to reflect on the lands that you are on, as well as your relationship with it. I invite you to take a moment, perhaps to share in the chat about the Indigenous lands from which you are coming from. Today, we're speaking from the RBCD clinic, which is located on what is colonially known as Toronto. This land is the traditional territory of the Haudenosaunee Confederacy, the Anishinaabe Nation, including the Mississaugas of the New Credit, the Wendat, and other Indigenous nations since time immemorial. Today, this land is home to many diverse First Nations, Inuit, and Métis people.
So just to continue with that, long before this land was stolen, it was and continues to be protected by the Dish with One Spoon, an agreement among allied Indigenous nations to share and care for the land and resources around the Great Lakes. This land is also subject to the Geswentha, an agreement originally made between the Haudenosaunee and the Dutch. The Geswentha is a living treaty that articulates relationships between Indigenous and non-Indigenous peoples based on peace, friendship, non-interference, and respect for each other's ways.
And I just want to reflect again, acknowledge that I come to this land as the child of Tamil immigrants and refugees from Sri Lanka. So this land has provided me and my family with the opportunity to go to school and work. But many Indigenous peoples don't share these privileges due to the ongoing legacy of colonialism.
And in my reflection, I'm not Indigenous, rather I'm a settler colonial ancestry. So my parents came to Canada from England, and I, like many others, have greatly benefited from living on the Indigenous land here on Turtle Island. I acknowledge and continue to learn about the brutal impacts of colonization and the impacts that this has caused. I come with respect for the land that I'm on today and for the people who have and do reside here. We'd also like to acknowledge that anti-Black racism persists in healthcare, education, housing, child welfare, employment, immigration, and justice systems. These systemic inequities can be directly traced to the legacy of the enslavement of African and African descendant peoples, which happened in Canada. We also recognize the excellence of Black communities, including resistance, as well as contributions to Canadian society. Today, when we talk about mental health, we ground the series on how anti-Black racism and oppression impact well-being and access to care. So now I'm thrilled to welcome our speaker today, so Aisha Saintiche, who will be kicking off the series with a presentation on mental health, with a special focus on for people with sickle cell, thalassemia, and other red blood cell disorders, as well as their support systems. So Aisha is a certified health coach and the founder and owner of Me to Moi Health. With over 15 years of experience in mental health, accessibility, and diversity and inclusion, Aisha has used her experience as a strategic advisor and health coach to understand the complexity and intersectionality of mental, physical, emotional, and spiritual barriers that keep people from achieving and optimizing their health and wellness. Aisha holds a master's in public policy administration and law, as well as certification in change management, advanced crisis intervention, and counseling and health coaching. She's also an integral master for the Canadian Olympic Committee of Canada and is a published author. Most recently, Aisha was selected as one of the top 30 women leaders to look out for in 2023 in the NYC Journal. Always seeking opportunities to bring about change, she is also an active member and board director of the Women of Youth Council of Toronto and the board chair for the FUE Groove School. So everybody, please welcome in joining Aisha.
So it is an absolute pleasure to be here again this evening. I did see some familiar names and faces. So again, it's really nice to be back here. I want to offer a special thank you to you, Sindhu, Colleen, and Bradley for the opportunity to be here with all of you and to really talk about an important topic that we know needs to continue to receive light on, right? So, you know, as we actively participate in this 5-part series, which I hope you've all signed up for all five events. You know, today we're really going to focus on mental health and what that means, right? So given the broadness of the subject matter, the reality is trying to cover all that there is under the issue of mental health would take us, you know, a really long time. And so today I really want to focus on our individual capacity to really understand what mental health is, how do we take ownership of that, and what are things that we can do proactively to take care of our mental health, right? Certainly, if we think about all that we have done in the last 3+ years, what we've experienced, what we've thrived through, we know that mental health has absolutely gained a lot more momentum, which I think is incredible and important as we all continue to weather, you know, these unprecedented times. And so as was noted, you know, as a certified self-coach, you know, my role really in this space is to empower individuals of all ages and stages of life to really understand what mental health means. Again, how we take ownership and control of it, where we have ability to do so, and what are the activities and things that we can do to take empowered action when it comes to our mental health, right? And even though we're out of the crisis phase and have shifted into what we like to call the endemic state, I am really aware of the fact that those who are joining this call today, whether you are someone who's living with a red blood disorder, whether you are a support system, a caregiver, that the aftermath of the pandemic has really elevated the impact of mental health, particularly with those living with chronic red blood cell disorders. And so again, I'm really cognizant of how these issues have heightened. And so again, I really want to celebrate and honor UHN and the clinic for creating and curating this space for these important conversations. The second piece of this, as we heard, is, you know, during this portion, if you can just leave your cameras off. But I ask that if you are willing and open to share, that you just do so with openness, with honesty. Certainly what we all have different lived experiences. And so as a result of our lived experiences, it comes with different perspectives. And while what, you know, somebody shares we might not agree with, what I always ask is that you please disagree with respect. Again, I encourage you to use the chat. If something that I said, if something that I share really ignites you, throw it in the chat. So you know, you might be offering a sentiment or a thought that somebody else might be thinking. And again, as you said, if there's, as Sindhu mentioned, if there's any questions that you have, please hold on to them. I'm really excited to answer any questions that might be coming up towards the end of this presentation. So for our time together, we're going to focus on 4 main things. First is really understanding what is mental health, right? What exactly does that mean? Second is, what does good mental health look like, and how do we get proactive about it? I want to spend a little bit of time talking about how we cope, because of course, coping is a really good identifier around where we are when it comes to our mental health. And perhaps, again, the most important part, again, is really understanding what parts of our life can we take ownership when it comes to our mental health, all right? So first, I want to start with a poll. On a scale of 1 to 10, and you can put this in a chat, with your current state, how would you identify your current state of mental health, with 1 being very poor and 10 being absolutely amazing? I'm going to open the chat so that I can actually see what people say. On a scale of 1 to 10, you can just throw your number in there. I see some 9s, I see a 7, that's very good. 4, 8. 7, okay. Okay, so it's nice to see that there's a number of us that are in a good place. Excellent. 7, please keep them coming. Keep them coming. 4. Thank you for sharing that, Zoe. And so the next question, as those of you are continuing to answer that first question, would you say that the state of your mental health in this last year has improved, has declined, or has it stayed the same? Again, you can put your answer in the chat. Would you say it's improved? It's declined, it stayed the same. Okay, declined. It's improved. Right. Same. Okay. Excellent. And as you're continuing, nice, improved. That's really good. Hopefully, you know, again, we know weather is also a really good indicator and can often be, you know, being able to get outside, being sunnier can also hopefully improve our state of mental health. So hopefully as the weather changes, the state of our mental health would continue to improve. But thank you for sharing. Please continue. And last question right now is, what are some of the challenges you are currently experiencing, if any, right? There might not be anything that's going on, but what are some of those challenges, if you're willing to share, and there's never any pressure to share if you do not want to. And what's being shared in the chat, I just want you to know, is also not, will not show up in the recording. Okay, unemployment, stress, yes. It's very changing times, staying at home, not working. Yes, please continue to add your thoughts to the chat. Stress, yes, stress is a big one, and stress can be, I mean, there's many things. You know, if we think about, again, the changes that are happening around us, a sick toddler, I hope that they feel better soon. So as I said, I want to just start with really creating an understanding around what mental health is. So as you know, when we talk about mental health, it's defined by the World Health Organization as a state of well-being in which the individual realizes their own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. And along with that, it's important to know that mental health is more than just the absence of mental health disorders or disabilities, but it's also about ensuring ongoing wellness and happiness, right? So it's an all-encompassing concept, or excuse me, experience. Mental health is important at every stage of life, from childhood to adolescence to adulthood. And, you know, I know there are some parents that are also participating in today's session. Again, I think if I'm going to offer any light that we experienced over this pandemic, it was the recognition that we also needed to pay attention to the mental health of our children, right? That they were equally as impacted around what was happening around us. And it's really nice to see that there's a lot more attention that's happening with our children, and equally to that of our senior community, right? Anxiety, isolation, depression, these are also quite prevalent within our seniors community. So again, I think it has shed some light on the fact that mental health can be experienced at all stages and ages of life. Mental health includes our emotional state, our psychological state, and our social well-being. And it also helps to determine how we handle stress, how it relates to others, and really the choices that we make. And what's really important when we're talking about mental health is to really make a distinction between mental health and mental illness, because oftentimes in conversation and when we see, or where we see there maintains or there continues to be a lot of stigma, it's a bit of an assumption that these two are the same things, and in fact they are very different, right? So in conversation of mental health, when it's brought up, what often comes up for people is things like depression, psychiatry, disability. You know, many people use the words mental health and mental illness interchangeably, but as I said, they are different, right? So mental illnesses are described as disturbances in thoughts or in feelings and perceptions that are really severe enough to affect your day-to-day functioning, right? Some examples are anxiety disorders, schizophrenia, and mood disorders such as major depression or bipolar disorder. Mental health, however, is a state of well-being, and we all have it. So just like we can actually have a state of physical health, we all each have a state of mental health to look after. So really, it's not just about surviving, but it's about thriving. It's about enjoying life and having a sense of purpose and really being able to manage life's highs and lows. And so from a statistical point of view, you know, 1 in 5 people in Canada will experience a mental health problem or illness in any given year. But 5 out of 5 of us, so that's basically all of us, have mental health. Right. And as I noted before, mental health isn't simply the absence of mental illnesses. And so what that means is living with a mental illness also doesn't mean that you cannot have good mental health, right? That's a stigma that we need to continue to emphasize, right? So just like someone with diabetes, for example, can live with a healthy life, so can somebody with a mental illness, right? And even if you don't have a mental illness, that doesn't mean that you feel great all the time, right? As we noted in the chat, we can experience stress, difficulty in life events, things that are changing. We can experience burnout. And so the reality is, just like anyone can catch a cold or a flu, everyone can experience the ebbs and flows of mental health and mental health and wellness, right? And that's why, again, it remains so important to continue to have these dialogues as a means of breaking stigma, of bringing greater awareness, and where we are able to really start to use language to indicate where we are. And so another important part around the mental health discussion is around the mental health continuum. Maybe using the emoji or the thumbs up. Has anyone ever heard of the mental health continuum? You can do the thumbs up or the heart. So for those who might be unfamiliar with the mental health continuum, it really refers to the range of well-being with mental health and mental illness at the two extreme ends, right? So depending on the circumstances of any individual at any time, they may find themselves at one point of the continuum and shift positions as their situation improves or deteriorates, right? So mental health changes over time and in response to different stresses and experiences. And certainly if we think about, again, all that we have been through in the last 3 years, what it is that we're actively trying to deal with right now, again, if with some of the things that were shared, any one of us can ebb and flow from being in the green to being in the red, which I will explain in a little bit more detail, right? So the mental health continuum, which goes from healthy, which we refer to as being in the green, to ill, which is often referred to as being in the red, has, as I said, that spectrum of where we can ebb and flow. So healthy, again, which as a state of being in, like thriving, is a normal state of health and mental health and well-being. And so various areas of your life, like your mood, your sleep, your energy, social interaction, and engagement are consistent. And so there's no real fluctuation. And if you look at the chart again, it kind of gives you, your normal sleep patterns, you're socially active, you're able to focus on tasks at hand, break problems into manageable chunks. Like, again, you're just able to move through the ebbs and flows of life. We then move to yellow, which is called reacting, or also, as I said, referred to as yellow. And it stands for an unsettled state of mind, right? So you may feel like you are on edge. You don't necessarily know why you're feeling that way, which can sometimes lead to greater frustration, right? You kind of just get up in a bit of a bad mood or just feeling not yourself and you're not quite sure why. Again, you might be feeling nervous or irritability. You might start to sense or feel like you're having difficulty sleeping. You might be a little bit more tired, decreased social activity. You might recognize your limits, get adequate, things like that. And again, I know, which I will talk more about, again, what are some of the connections between living with a red blood disorder and mental health. But again, this is just to offer more intel and knowledge, because sometimes we're not always able to articulate how we feel or exactly what we're feeling. But what's really nice about the mental health continuum is you can refer to it by colors, right? So if you say to someone, I'm in the green, then whether it's a family member or a practitioner, a social worker, someone that you're working with, even a friend, they're able to say, okay, you know what, so and so is in a good place. If they say I'm in the yellow, or if you say you're in the yellow, again, it gives the people around you, even for yourself, an indication that it's time to be a little bit more cognizant of what's happening around you or how you're feeling. The next zone is that what we call injured, struggling, or the orange zone. And so if we find ourselves in this zone, we're in significant trouble, right? It's a bit of an indicator that we really need to tap in and perhaps seek out supports. So we may find ourselves extremely anxious, angry, extremely moody, and struggling to do anything. In this state, we may feel pain, both emotionally and physically. We may feel numbed or empty. Thoughts will be increasingly negative. For example, ideas of worthlessness or others dislike us. Basic habits are also affected, right? We may have little appetite. We may be sleeping poorly. We may be fatigued. Again, increased social isolation. And certainly if we find ourselves in this zone, it is really important that we seek out or reach out for help before ending in the last zone, which we refer to as the ill, crisis zone, or the red zone. In the crisis, those that are in crisis means a person is in a state of great suffering and really needs immediate help, right? Their emotional pain may be so unbearable that they want to take their own life, which we've seen, unfortunately, an increase in suicide. Symptoms include more severe anxiety or depression, or even at the same time, right? There will be great difficulty in performing work, just in general activities, daily acts of personal hygiene, eating and sleeping. You may find that their desire to stay in bed, not go into work, if you are able to go to work, may call off sick. And what it also can do is, because it's not your actual state of being, it can increase feelings of shame, right? And therefore increasing anxiety. And so we may also see the development, which we have seen over the last 3 years, increase in addiction and self-harm and extreme behaviors. And so understanding that there are many factors that affect our lives, right? So it isn't just, as I know, just around mental health, but, some of the things that were shared around unemployment, around food insecurity, around housing insecurity, again, the lived experience of living with a red blood cell disorder are all compounded and can actively and in parallel affect our mental health. But as I said, having the language and being aware of what your normal state is and when you start to ebb and flow up and down this continuum is really important in when it is important for you to perhaps seek out support or reach out to someone to say, you know what, I've been feeling okay, but I'm starting to feel like I'm not, and what supports are available. So a really cool resource, which I can put in the chat after, is called The Working Mind. It's not a diagnostic by any means, but if it answers a few questions, it asks you a few questions, and you plug in your answers, and it will tell you where you are on this on that continuum, right? Again, it's not an exact science, but it at the very least can help you put a name or a color to how you may be feeling, and again, give you a little bit more insight into where you may need to seek support or reach out to someone, right? And so now when we talk about the impacts of a chronic red blood disorder on our mental health, again, this list is absolutely not exhaustive, but these are some of the main ones that we see, right? Individuals living with a red blood cell disorder experience physical limitations, again, that we know can, negatively affect the daily activities, which may cause feelings of depression and fear and stress and isolation, right? Physical symptoms such as chronic pain, fatigue, weakness, multiple hospital visits, blood transfusions, financial, social, personal challenges, again, as many of you indicated, which I thank you for sharing that, lack of family and social support, changing body image, impaired self-esteem, and again, many other complications associated with these blood disorders can really strongly affect someone's mental health and wellness, along with the emotional and psychological effects. And so, as I said, this list is certainly not exhaustive, but we see depression. So as a result of, chronic pain, frequent hospitalizations, and limitations on physical activities can really contribute to feelings of sadness and hopelessness. We see anxiety. Of course, individuals with varying blood disorders may experience anxiety, right, related to the unpredictability of some symptoms and the need to manage the illness on a daily basis. There's post-traumatic stress disorder, right? So frequent hospital visits and hospitalizations and painful procedures can result in traumatic experiences, really leading to symptoms of PTSD, which we know can adversely affect mental health, social isolation. Individuals, again, that are experiencing chronic red blood disorders may avoid social situations due to fear of experiencing pain or complications in public, leading to feelings of loneliness and isolation. And some time ago, it's 2023, I think a year and a half ago, I had the privilege again of doing a workshop with Sickle Cell Ontario. And again, the main topic was around the impact of COVID living with sickle cell and isolation, right? And what the impacts were of that. So that remains, again, a real indicator that can affect people's mental health. And then, of course, there's the stigma. Right, the stigma surrounding chronic red blood disorders can really contribute again to feelings of shame and low self-esteem. And so recognizing that the impacts of living with these red blood disorders is also not one-dimensional, but in fact is complex and involves issues that are not fully in control of the person. Again, I want to shift gears a bit and really explore how important and a secondary conversation connected to the topic of mental health is, and that is around how do we take ownership. And I think towards the end of my presentation, I do list out what are some of the other topics that are going to be covered. And I think Sindhu and James will bring that up. But again, the next conversation I'll be bringing to the table is around intersectionality and mental health, because that, again, is an additional, an important topic to talk about when we talk about our ability to manage mental health, but some of the other dimensions of diversity and intersections that we live with that make dealing with our mental health harder, that I think is a really great conversation to have. And so now when we talk about, in order to explore what it means to take action or to be proactive when it comes to our mental health, it's important to understand, what does good mental health look like? Again, this is not an exhaustive list by any means, but these are some of the overarching concepts that we talk about in this space when we're working towards what does good mental health look like, right? So the first is a sense of purpose. It is ensuring that we have strong relationships and connections around us, certainly feeling connected to others. What's really important is having a good sense of self, of who we are, our purpose, our power, what it is that we bring to the table. General enjoyment of life, and of course our ability to cope with stress, which again is something that I will touch on a little later on in this presentation, right? And so achieving and maintaining good health isn't just a one-person journey. So that's also really important. So while we have, we need to take ownership of our own life, right? We have to be mindful of our setting, our situations, the people that we're connected with, our environment are all factors that can positively or negatively affect our mental health. And so another question that I want to ask, and please, put it in the chat, what is something that you could do or something that you actively do right now to take care of your mental health? Like, is there something that you do that brings you joy, that you enjoy doing? If you're feeling a little bit of high stress, if you engage in this activity, that your stress declines, that your stress reduces, or is there something that you would like to do that you think would be beneficial to your mental health but haven't had a chance to get to it? Again, feel free to share it in the chat. For some, it's going outside, going for walks, drawing, journaling. Yeah, that is a big one. Exercise, swimming, yes. Going for walks, yeah, more often. As the weather gets better, it entices me. Listen to music, counseling, meditation, and exercise. Meditate, that's amazing. Counseling and therapy, yes. We will get to that around the importance, absolutely, of again, seeking supports outside. All right. Again, keep them coming. So one of the first things when it comes to taking care of our mental health is staying positive. Now, when I say stay positive, a lot of times people are like, oh, geez, Aisha, like, what do you mean stay positive? Like, there's all these things that I'm going through. So I'm not talking about the toxic positivity that says that we have to pretend like the things and the struggles that we're going through life, like we're just happy. I call it the lollipops and gumdrop syndrome, where we just are supposed to act happy even though we're not feeling happy, right? That pressure to stay upbeat no matter what is happening around us, right? This can happen when people believe that negative thoughts about anything should be avoided. When I talk about staying positive, it really is about being optimistic. It really is about allowing ourselves to experience the ebb and flow, all the emotions that we feel in any one given day, because those feelings are real, right? So again, I'm talking about, is our ability to recognize that through a storm, there will be light. Sometimes we can't see it. Sometimes we don't believe it's going to be there. But again, so long as we remain optimistic that things will get better, even if it's for a short period of time, then what we're open to is experiencing life, which means that we are also better positioned to come out on top and to feel positivity. So again, it's really important to emphasize that when I say positive, it isn't just always putting this smile on and that all things are great, but it really is about looking for the positives and the optimism in situations that sometimes don't feel like they're that great, right? And so what I'd like to add to this speech, which is something I say, is, being mindful as well of the information that you take in. So one of the things as a coach that I almost prescribed to many individuals that I was coaching, particularly at the peak of the pandemic, was for people to be really mindful of the information they were taking in on social media and on TV. We really do not understand or recognize the impact that negative information has on our actual mind and body, right? If you're watching the news constantly, watching CNN, I know that's a really popular one. If you're constantly scrolling on social media, I mean, and of course you get into that algorithm. We are fed a lot of information that can have a negative impact on us, right? So being mindful of the source of information, how much information, where you're getting information from is really important to, again, not living in, the unicorn land, but at the very least, really putting boundaries around all the information that we get and creating spaces in an environment where we can stay positive, right? So being mindful of rumors and all of that negativity. The second part is around practicing gratitude. So again, in the chat, does anyone practice gratitude? Like whether it's before or after, whether it's in journaling, you can put just yes or no. Is gratitude something that you actively do? Say yes or no. And if it's a no, it's no worries. Sometimes, okay. Yes. All right, keep them coming if you do. Sometimes as well. Yeah. It depends. I am on the sometimes as well. Sometimes I do it, sometimes I don't. Sometimes I'm really good, and then sometimes I fall off. But whether you do it, whether it's something that you do consistently, whether it's something that you do in the morning or throughout the day or in the evening before bed, right? Practicing gratitude is really important, right? Now, most times when I ask people, do they practice gratitude? They will say yes. And what I will then ask is, what are the things that you show gratitude for? Most times it's family, it's for their loved ones, it's for if they have a good job, if they have kids, it's all the things, kind of externally that they're grateful for, which is really important. But I want to take it one step further when we're talking about, again, being mindful of our mental health and really finding ways to take care of our mental health is when you do your gratitude practice, are you showing gratitude for yourself? Are you showing gratitude for your ability to be resilient and to push through what can be some of the toughest times, the ups and downs, again, with, that you're going through? Do you show gratitude for yourself and add yourself to that list of things that you are grateful for? And the funny thing is, a lot of times when I say that, people are like, oh, gratitude for myself. Like, that seems like an interesting concept. But what I share about that is all these things that you show gratitude for, whatever that list is, you are grateful for them because of, the way, again, they make you feel, the way, whatever that looks like. But you are the source of that, right? People only reciprocate love and kindness and make you feel good because of how you make them feel. And so giving yourself gratitude, showing yourself appreciation, being mindful of what it is that you thrive through every single day is really an important part of taking care of our mental health and being proactive and being intentional about how, again, we are nurturing our mental health, right? Because a lot of times when we talk about mental health, what happens is we only enact these things. And again, we'll talk more about what are some actions. And I know many of you shared it already. We enact things that take care of ourselves. Yes, giving myself a treat when I meet a goal. Absolutely. Is that we will enact some level of support or some gift to ourselves at the end, right? Only when we've hit a goal, which I think is really important. But we need to do that every day, right? We need to wake up and say, you know what? I'm really just grateful for myself. I'm grateful that I continue to push through. I'm grateful that I continue to, put one foot in front of the other in spite and despite of the things that are happening around me. Offering your own self those positive affirmations is really important, an important part of our mental health. So if practicing gratitude isn't something that you do, I would at the very least encourage you to bring that practice in and make sure that when you are going through your list of gratitude, that you are on that list. The next piece is around, is around taking care of our physical health. So now again, when I talk about physical health, actually, I want to ask another question. So when it comes to physical activity, I'd love to know, and I'm going to define physical activity. Do you love it? Do you loathe it? Or do you like it? Again, put it in the chat. Is physical activity something that you love, something that you loathe, or something that you like? Okay, like slowly turning to love. Love it. Okay. Okay. Michael loves it. Amazing. I love that. Excellent. Excellent. I did a session a little while ago. And I think I had the majority, it just so happened that the majority of the people that I was connecting to loathed it. It was actually pretty interesting to hear that that amount of people loathed it. But great, it's good to see that there's a good number that like moving to love or that love it. And so again, when I talk about taking care of our physical health, a lot of times people will go and feel pressure around what I'm talking about, or when we hear physical activity, right? That it is meant to be full throttle, like marathon running, or and that's not what I'm talking about, right? With full awareness, right, of some of the physical challenges that do come with living with a red blood disorder. You know, what I want to emphasize is that physical health I speak of is not about these intense workouts, which is fine if that is something that you do. I saw swimming, and again, Michael indicating that he absolutely loves to work out. But what I'm talking about is the basic but everyday movement all of our bodies need to improve the quality of our life, right? We have really swung the pendulum and have spent a good portion of the last 3 years sitting in front of a desk, being online, being on Zoom, whether you're, meeting with your doctor or in a meeting. And so our movement of our body has really changed. You see, physical activity oftentimes is seen as something that we have to do. And so similar to, because we're adults, or, if we do have youth or children, when you're adults, you have to pay bills. You have to change the filter on a furnace. If you're an adolescent, maybe you have to take out recycling. Children, you have to go to school, right? Anything that we really have to do, we don't necessarily meet with the most amount of enthusiasm. But I want to, again, put the question to you around shifting from physical health being something you have to do, being something that you get to do. Because the things that you get to do, and much of what you shared already in this chat, are things that bring you joy, things that make you feel good. And when we're actively engaged in things that make us feel good, it automatically has a positive impact on our mental health. It doesn't mean it is addressing all of our issues, that it puts a blanket over some of the struggles that we have. But when we think about the things that we get to do in our lives, these are things that we willingly do, not begrudgingly do when it is something that we have to do. And so even making that small shift in the mindset around the benefits of our physical health and physical activity, no matter how high impact or low impact, is really important, again, to really taking care of our mental health, setting targeted goals that are achievable. Again, is a really important part of being proactive when it comes to our mental health. We then have nourishing the body, right? So in the chat, again, I would love to hear, what is your favorite food? Like, what's your go-to? Whether you're in a good mood, you're in a bad mood, what is your favorite food? Soup. Oh, constant. Listen, that is my thing as well. I love soup. All kinds of soup. Soup is, and all year round also. Cold soup. Oh. Cheese, Cynthia, as well. I think everyone's about to list. I love cheese. I love cake. I have a very sweet tooth. Anything sweet? Yep. You and me, Michael, we're on the same. Fruits. I like fruits, but I feel like I would take cake over fruits, depending on the day. All right, so we have cheese, absolutely. Soup, very cool. Very, very cool. These are all tasty, and I think are all pasta. I also enjoy pasta. There probably isn't anything that you're all saying that I don't enjoy. But again, when we talk about, food can also significantly and positively impact our mental health, right? So again, I want you to think about this, right? When you eat your favorite foods, how do you feel? Right now, this by no means, I don't want, Michael, I don't want you to go to your doctor and say, I actually heard this lecture and a certified health coach said that to keep me happy, I'm going to only have to eat cake. Absolutely not. I'm not suggesting that by any means. But I want us to, again, similar to physical activity and physical health, I want us to see food as fuel. It can certainly be one of enjoyment, which is important, but we also have to understand the benefits of good food and carbs and sugars, how they make you feel energized, how they clear the mind, how they can, make you feel just energized, right? So think about, if you eat a super heavy, greasy meal, it absolutely tastes good, but how do you feel, right? An hour, 2 hours later, you might feel heavy, you might feel lethargic, there might be that brain fog. When we eat foods that are across the rainbow, right? Our fruits, our vegetables, drinking water, really seeing food again as that source of energy and clarity for our mental health, we are already, again, actively and proactively taking care of our mental health. So the truth is food does two things when it comes to our mental health, right? It can be an indicator of our state of mental health. And again, this is not a perfect science, but if we find ourselves indulging or gravitating to junky foods or foods that we know are not good for us, that don't support our other aspects of our physical health, then I need you to pay attention to what that means about your mental health. Again, not a perfect science, but we have a tendency, when we're feeling not so great, our inclination is not necessarily to pick up carrots. It might be to pick up a food that is a comfort food or makes us feel good. The second thing to notice about food is food can promote and support good mental health, right? Again, so similar to that discussion that we just had about physical activity, don't see eating well as something that you have to do, but really see it as something that you get to do to really take care of your overall health. Nourishing your body and nourishing your gut has a direct connection to your mental health and the clarity, right? So again, I'm certainly not saying don't indulge in the foods that you don't like, that you like, but it's really important to understand the benefits of food and seeing it as an indicator of where you might be, again, along that mental health continuum. Another one is taking care of the mind, right? And again, if for those who had a chance to see what this Wholesome series is, the last two sessions are on mindfulness and around meditation and the importance of really taking care of our mind as an act of self-care and as well as an act of taking care of our mental health, right? The work that we all do really requires, no matter what that is. So, whatever you do in life, whatever it is you're going through, taking care of our mind is really important when it comes to our mental health, right? The intentional ability to quiet the mind is important. And I'm going to also add to this, because for me, I'll be honest, mindfulness is a struggle. I have a really difficult time quieting my mind. But when we talk about mindfulness, it really is about being present. And I really don't want to take away with what's going to be shared by Rena, because she is absolutely a guru when it comes to this space. But being mindful is being in tune with what's happening around us, being in tune about where our mental health and state of being is, being mindful of what's around us, the people around us, the environment, how we're feeling, quieting the mind a little bit, right? That inner chatter that sometimes has a way of just continuing to send messaging, right? And so number one, I hope, you have signed on to all the sessions, but in particular, those last two sessions that really gives some great tips and tricks around what and how we take care of our mind, as it is, again, the main source when it comes to our mental health. Something that was shared in this chat is around seeking professional help, right? If you're struggling with mental health issues, if you have a question, if you are not struggling with mental health, but you want to be proactive around making sure that you stay in the green, seeking professional help is so important, right? A mental health professional can help you develop coping strategies, can help you manage stress. It can be just someone who's not directly connected to you to give you information and advice that will really benefit you in your future or in decisions or in choices. And again, the more we normalize the importance of seeking support is the more that we build a culture that reduces shame and stigma and the need for secrecy when it comes to mental health. And again, in the next session, when we talk about intersectionality, this is very much addressed because, again, depending on the dimensions of diversity, our lived experiences, our culture, seeking professional support can be very, very difficult and is often associated with shame that makes it, increasingly difficult for individuals across various spectrums to seek support. So for those who are actively engaged in counseling and therapy, it's absolutely amazing. Kudos to you. I would encourage you to maintain so. And if you are not, again, seeking professional help doesn't mean that you're in crisis, but seeking support is a great way around staying in the green, and just being proactive around your mental health. Staying on top of your medical appointments, right? Regular medical care is essential, right? For managing the various chronic diseases that might be chronic diseases. So, you know, again, it's important that you attend all appointments and take medications, you know, that are prescribed to you. Again, I think this all works in tandem with, again, seeking support, making sure you're eating well, physical health, all of these things that we're talking about don't just happen in isolation. They actually need to be happening all in parallel, right? We are multidimensional people, and our mental health is multidimensional, as we've talked about. And so enacting only one of these activities will make you feel better. But being proactive and finding ways, again, to take care of ourselves in all of these different aspects of our life only increases our chances of again, being strong when it comes to our mental health. And what's really important, of course, is staying connected to your community. And when I say community, I don't necessarily mean the community at large. I mean, you know, those that are within your circle, the people that you can count on to support you. Again, whether you are someone who's living with a red blood disorder, whether you are a caregiver or support system, having that support system is really important. And if there's, you know, one of many things that we have learned over the last 3 years is that human connection is essential for overall health and well-being. And certainly at the peak of the pandemic, where that was limited and actually restricted, we saw the outcome of social isolation and not being able to connect with people in your circle. And really, again, in this space, you know, I'm seeing kind of the secondary outcome of particularly among children and around youth, around the struggles of interaction and socialization, because there was so much restriction around their ability to stay connected to their communities, right? And so one of the best ways, again, to manage, you know, just again, the various experiences is to make sure that you have a support system. And when I say support system, again, it doesn't need to be 20 people. It can be one person. It could be 2 people. It could be a mix of your family, individuals within your respective communities, culturally, just who is around you to continue to support you, right? Really important. Some of the other things that you can do, and I think this was mentioned in the chat, journaling. Journaling is a big one. You know, about your day to get better perspective and keep track of achievements, not what was completed. So this is a really important one. We have a tendency to only feel that we have accomplished or that things are going well when we're able to check off the checkbox of all the things we did, that we wanted to do. But what's really important is to identify what it is that you did do. Right? So journaling, no matter, sometimes a journal isn't even just writing, it can be doodling, it can be coloring, anything that just allows you to articulate on paper how you're feeling, how you're doing, again, what the day was like. Check in with yourself, right? We are always willing to check on other people, right? How are you doing? Whether it's a family, it's our child, but we very rarely check in on ourselves, right? So develop that emotional self-awareness. And check in with yourself to see how you're doing. Where you can, slow down, right? There's a lot happening for us, around us, any one given day. And so where you can and where there's opportunities to do so, please, by all means, you know, try to slow down. Spend time in nature and intentional solitude to clear your mind and recharge, right? Over the pandemic, I do not know that our forest ever saw so many people in them than they did over the last few years, when it was essentially one of the few things that we were allowed to do. But spending time in nature, the quiet, the air, the grass, hopefully you don't have poor allergies, again, can really help to bring calm and just clear our mind of what's happening. End of day, reflecting on the things you did enjoy, even if it seems small, right? Kind of going back to that gratitude piece, right? That being grateful doesn't have to be huge. It can be something as small as, you know what, I wrote in my journal, or I attended all of my appointments, or I was feeling really good today and I ate a great meal that made me feel good. Everything and anything that you believe to be worthy that contributed to a positive day is always worth reflecting on. Setting healthy boundaries, very, very important when it comes to our mental health. Depending on your personality, who you are, how you like to operate, sometimes we struggle to set boundaries, particularly with those that are in our innermost circle. But self-care requires us to establish boundaries and to lovingly say no to someone if it is infringing on our time or our ability, or if we're struggling mentally, or just struggling in life, right? It is okay to say no. And hopefully the people around you understand why you're saying no, that you're not saying no because you don't want to do for them, but really because you need to place that energy and time on yourself. So where you can, really important to set healthy boundaries. And the last is to really dedicate time to relationships, right? Nurture the support system, the community that you have. I know in an age of technology, it is really easy for us to send a text message, to send memes, but where you can, right? Connect with people, pick up the phone and call someone, meet up, again, if you're able to, but really nurture those relationships that are important to you. And so now I just want to shift gears a little bit and talk about coping, right? So this is a very, I'll call it a technical definition of coping, but really coping is the conscious or unconscious strategies used to reduce unpleasant emotions, right? And again, if I can put it even more simpler than that, coping is really our ability to deal with hardship, pain, or struggle. Now, something that I want to share with you is that our ability to cope also is not black and white. So it's not a yes or no, right? Meaning that the same situation could occur on more than one occasion, but our response will be different based on the circumstance that may be happening, the timing, who it involves, who it involves. However, when we're proactively engaged in activities and actions that promote and support good mental health, our ability to engage in good coping skills is actually heightened, right? And so again, one of the, another poll question, do you feel like you have good or bad coping skills, or does it depend on the situation? So again, you can put it in the chat. Do you think you have good coping skills, bad coping skills, or it depends? Yeah. I feel good. Excellent. Depends. Thank you, Helen. Depends. All right, we'll keep them coming. I think a lot of times people are definitely on the it depends. So another question is, can you recognize within yourself when you are engaging in coping skills that are hindering your mental health and wellness, right? So, there's a little voice in our head that says, like, you're not supposed to be doing this, but I'm going to do it anyways because this is what I need to do. So can you recognize within yourself when you are engaging in coping skills that are not good for you? Yeah, absolutely. And that's very true, Laura, right? And so that, again, the recognition of that, however, is really powerful because, again, we're a lot more conscientious around, where and if we can address that. It's not a perfect science. It is not a perfect science by any means, but the recognition that you are not necessarily engaging in good coping skills is actually a plus because you're not in denial, right? The next question is, how do we support a changed outcome? Pushing myself, absolutely. And as we said earlier, right, depending on the circumstance, depending on the time, depending on who it involves, we can elicit, some great coping skills, or we may not. Because in the moment it feels great, yeah, absolutely. But after that, yeah, absolutely, right? I mean, we're all human. We are all human, and so there is no perfect science. There's no perfect outcome. We can, engage in everything perfect, not everything, because perfection doesn't exist, but we can engage in all positive activities for an extended period of time. And then something can happen, a situation can come up, a particular individual or environment, something that we're going through, and it it doesn't set us back, but we engage again in activities and actions that we know don't serve us, right? But I think what's really important is for us to be mindful of the actions of the activities. And I think, the reoccurring thing that I'm seeing in the chat is that everyone here is aware of the fact that they might not necessarily be engaged in the best activities. And so what that does, and I think I saw that here, is that it allows you an opportunity to reflect and think, okay, what could I have done better? If I do find myself in this prediction, the next time, what would I do, right? And so when it comes to, again, owning the state of our mental health, right? And really taking care of that. I want you to kind of think about, again, that first question, right? In that many of you identify the fact that your mental health is really positive. And so what that tells me is that, again, at this current state, again, the ability to engage in good actions, make good decisions is there, right? And again, that's why it's so important for us to actively engage in good activities, to be proactive, to explore ways that we can take care of our mental health. Because when those moments dip, what we want to do is pull on all of those already entrenched activities that keep us in the green, right? So again, coping practices, but still, again, you can still have, good coping practices, but still be experiencing poor mental health. So again, there is no one way to cut this pie. But again, what I think is really important is for us to be aware of the signs and the things that we're doing that either support or create greater barriers to our mental health, right? And so it's important that we see how every single aspect of our life, right? What we eat, how we sleep, the nature of our relationships, both intimate and platonic, the relationships we have with our children, our work environment, our support system, our family dynamics, our sleep patterns, movement of the body, self-care practices, and that list goes on, all can positively or negatively affect our holistic mental health and wellness, right? So remembering you are a whole person. And so that means your approach to your overall health and wellness must take a holistic approach, right? Recognizing that many things around us, right? Many things that you're actively experiencing, living with a red blood disorder is unpredictable. Right? And so what are the things within your life that you can control, right? You can, to a certain degree, control what you eat and how it makes you feel, your ability to build great relationships, to engage in physical activity, again, where it's feasible, that makes you feel good, taking care of your mind, engaging in journaling, all the activities that we talked about that I suggested and that you're actively engaged in are ways that we can take responsibility for our health and wellness, right? And so the act of taking empowered action and taking care of our mental health is only as good as our commitment to this, right? So it's easy for us to kind of sometimes step into these spaces. We get some really great information. And again, I want to thank you all for sharing what you've shared. But then we don't make an intentional commitment around what it is that we're going to do from this day forward. It's 7:33 p.m. May 4th, what we're going to do, or what are the things that we're going to commit to when it comes to our mental health and wellness. And so I want you to take just like a minute and tell me, what is it, or what is one thing, right, that you're going to commit to when it comes to supporting your mental health and wellness? Like off the top of your head, what is something that you think you can enhance, that you can do, that you can start doing? This can even be something that you want to eliminate, right? Because part of this process is also letting go, moving past things that don't serve you, that that's people, places, and things that are no longer serving your mental health, right? Talk to my loved ones about how I'm feeling more often. Absolutely, right? Daily gratitude. And please make sure, Kathy, that in that gratitude, you are including yourself. Yes, I love that. Appreciating myself and self-worth. Letting things I can't control go. That is probably one of the hardest human behaviors, right? We spend a lot of time trying to change things that we actually don't have control over. And I want you to think about the energy you are expelling sometimes on people, places, and things that really don't deserve your time and energy, right? That's all part of our mental health, right? It's not, as I said, it's not one dimensional. It's not just about what we eat. It's not just about physical activity, but it is also about controlling our environment, being mindful of who we allow into our space and how they affect positively or negatively our mental health, giving myself more gratitude. Yeah, checking in with myself daily, right? Again, reminding ourselves that we will actively support everybody in our life. We will ask how they're doing. We will make sure that they're feeling okay, but we don't offer ourselves the same grace and gratitude. So I actually love the fact that I see many of the commitments in this space is about the self, right? If we're going to take ownership of our mental health and wellness, then we have to put ourselves at the top of the list, right? And again, I say that as whether you are a caregiver or you are the caregiver of someone who is living with a red blood disorder or someone who is living with a red blood disorder, your capacity and ability to operate as your greatest self, to really take care of your mental health requires that you put yourself first. So the self-care piece, checking in with yourself, giving yourself more grace and gratitude, appreciating all that you thrive and do every single day is a really important part of taking care of our mental health, right? So I'm actually really happy to see that there's a lot about the self in this. And so, as I said, this is an incredible 5-part workshop, with today being the first one. If you haven't signed up for all, I really do hope you do, because the next one's going to be a really great conversation as well around intersectionality and mental health. We then have how to stay in the green. I actually have to apologize because this is possibly what Sindhu and James are doing. So I'm going to go through this quickly because they probably are doing this as I'm showcasing this right now. Introduction to mindfulness and the importance of mindfulness and self-compassion. And because I am someone who absolutely loves a quote, just as a means of offering inspiration, I remind you again that mental health is not a destination, but a process. It's about how you drive, not where you're going, right? So again, oftentimes when we get into these spaces and we decide to take a proactive approach, we feel like we have to turn the light switch on and that we have to go from 0 to 100. And what I would say to you is lasting change happens incrementally, right? So as you continue on your journeys, as you continue to explore all the different things that you can do in your life to protect and enhance your mental health, make sure that you are recognizing all the micro changes that you're making along the way. The end game is amazing, but the greatest lesson you will learn is what's happening along that journey, because that's also where sustainable change happens, right? So give yourself that grace. Make sure that you are giving yourself the time, again, to make these incremental but lasting and sustainable changes. And again, remind yourself that mental health, again, it's not a destination, it is a continuum. Just like that continuum, so is a period, right? So is our journey around mental health. I love that. Thank you, Michael. I love that one. And that actually brings me to the conclusion of the presentation.